A lot of people have to go on Medi-Cal. A lot of people have to get insurance through the government. You're a healthcare company. You should be able to do something.
You own Aetna, you own Caremark. There's no way you can't tell me you cannot find a way to come up with a package for your employees.
CVS owns one of the largest health insurance companies in the country. But 64% of CVS workers in California don't have employer health insurance, according to a survey by their union local, the UFCW 770.
It's crazy enough that we're underpaid, but now you have to put a large portion of your pay towards your health care, where people now all of a sudden have to decide, do I want to have health care or do I want to put food on my kids' table?
CVS workers in Southern California went on strike on October 17th. After 6 months of negotiations, the union and CVS have reached a tentative agreement that would address many of the issues we heard about from workers. But CVS employees all across the country will continue to experience these issues, and worse.
CVS has gotten cheaper and cheaper. All they've been interested in is just keeping their profits.
CVS made $8 billion in profit in 2023, yet many of its workers are on public assistance. Of the many issues at play, none is more painful or ironic than the unaffordable employee health insurance plan offered by CVS, the second biggest healthcare company in the world.
Do I have insurance through CVS? No, I don't. I have it through government assistance, which is Medi-Cal.
It sucks because it's basically, there's times when I know I'm sick and I know I need the medication, or I have an issue, I have a pain or something, that I can go to the doctor and I can have that remedy fixed easily. But I can't do it because guess what? I don't have health insurance. Going to urgent care is going to cost me a couple $100s. Getting the medication that's going to add on to the price.
The company has two separate and unequal health insurance plans. A more affordable plan for A stores and a more expensive plan for B stores. What's the difference? Nothing really. Workers at stores CVS bought in 2007 to 8 are A stores. The ones that came later are the B stores. That's it.
We even asked them about it. It's like, can we, get the healthcare into one healthcare? And their response was no, it's not reasonable. It can't happen.
Part of the problem workers face is CVS's dominance of the pharmacy market, which gives it power to push poverty wages, skeleton staffing, and unsafe conditions at retail pharmacy stores. Even as it closes stores itself, its sheer size allows it to dominate.
It's not about what's best for the community. It's not about what's best for the workers. It's about cornering the market. It's basically killing competition.
Industry-wide, an estimated 7,000 pharmacies have already shuttered in the last 5 years. Walgreens just this week announced 1,200 of its remaining stores could soon close, and Rite Aid filed for bankruptcy last year.
You have basically a few mom and pop pharmacies, and the sad thing is they bought a lot of those out. They bought up so much stuff just to basically take away all the competition they could.
It's unfortunate when these pharmacies close because these customers have to go, to the next store over. And what ends up happening is these customers spread to the nearest stores and then the workload increases.
So in pharmacy, it's always hectic. They want us to do like a million things at once, basically.
We're working with one hand behind our back, and CVS is basically trying to see how many people they can actually cut down to make the most profit. They profess how much they care about the patients, but they don't give us the time to actually give the patients the care that they actually need.
The issue plagues front of store staff too.
Being understaffed frustrates a lot of the customers. They would prefer to come in, get their stuff, and get out. However, so many things have been locked up due to theft that customers are forced to wait for somebody to come along with the key to help unlock that product. But there's not enough people in the front store working.
Safety is a big concern as well.
People who come to the store to steal, if they are called out on it, they will go violent. I've seen my coworkers be shoved. I've seen my coworkers be almost punched in the face. It's ridiculous. I don't ever feel safe at work. I've never felt safe at work.
My particular store has been robbed 3 times in the pharmacy. The first time I was there, they were remodeling and my store was robbed and I was held at gunpoint. I mean, I'm not completely 100%. I'm never gonna be the same because of that happening,
A full, long weekend on strike forced CVS's hand.
I'm, just your basic, average, everyday, ordinary, run-of-the-mill, ho-hum fella who just happens to work for CVS, be a member of a union, and live in one of the most expensive cities and be living under $30,000 a year, I think if I were even earning slightly more than that, I would have a bit more pep in my step when it comes to both workplace and life.
We're willing to fight for safety. We're willing to fight for a livable wage. We're willing to fight for what we need in order to survive, you know?